Good day everyone. For this video, we will discuss about the why blood transfusion matters and its importance. So, a health education by Vanessa De Ligero, Kimberly Mahilom, and Kristen Joy Mondrian.
So what is blood transfusion? A blood transfusion generally refers to the transfer of one person's blood to another person. It is a routine medical procedure in which donated blood is provided through a narrow tube placed within a vein in the arm.
So, the indications for blood transfusion: blood should be treated as a drug that must be prescribed with caution. There are both indications and contraindication for giving a blood transfusion. Indication includes severe anemia, when the oxygen capacity of the blood compromises major organs, severe hemorrhage, anemia of chronic disorders or renal failure and cancer, hemoglobinopathies, sickle cell disease, thalassemia.
For the contraindication, megagloblastic anemia, vitamin B12, or folate deficiency transfusion may cause heart failure and death. For iron deficiency anemia, transfusion in healthy adults and children were used to oral iron could rectify a low hemoglobin.
So the nursing responsibilities of the nurse during blood transfusion. So before, the nurse must verify doctor's order, inform the client, and explain the purpose of the procedure, and then check for cross-matching and typing to ensure compatibility. Third, obtain informed consent and health history. Fourth, confirm health history and any allergies. Fifth, conduct a thorough physical assessment of the patient, including vital signs, and double-check the patient's identification and verify the actual product. During the blood transfusion, the nurse must assess and document the patient's status, prepare the white tubing with normal saline, and have the blood ready in an infusion pump. Third, run the blood slowly for the first 15 minutes, and then remain with the patient for the first 15 minutes. This is when the most transfusion or reaction can occur. Fifth, increase the rate of the transfusion after the period if your patient stables and doesn't display signs of a transfusion reaction. And sixth, document vital signs after 15 minutes.
After, flush white tubing with normal saline, and second is dispose of used white tubing in a red biohazard bin, and lastly is to obtain post-transfusion vital signs and document the patient's status. So that's all for today's discussion. Thank you for watching.